Assalamualaikum everyone. Today I will present a case called sperm granuloma in a bug. This case is about a young goat that wasn't producing sperm and we had to find out why. First, let me explain what a sperm granuloma is. A sperm granuloma is a small lump or swelling that forms when sperms get stuck inside the epididymis. When the ducts get blocked, sperm can't come out, they leak into the tissue and the body reacts by forming inflammation around them. This creates a hard swelling. It is not very common in bugs and it doesn't happen. It does happen and can cause infertility. The patient was a 7-month-old son buck. He had been tested before and was labeled azoospermic, meaning he was producing almost no sperm. The buck looked healthy, normal temperature, normal walking, normal body condition. But when the scrotum was examined by palpation, the vets found a firm, smooth swelling above both testes. This swelling suggested that the problem wasn't inside the testes but in the epididymis, where sperm normally travels. Semen was collected using an electroejaculator. Only a very small number of non-moving sperms were seen. There were not enough sperm to even check their shape or quality. This told the vets that sperm were being made but not coming out properly, which again pointed to a blockage. The next step was an ultrasound. The ultrasound showed the testicular tissue looked completely normal, but the epididymal heads were enlarged and filled with fluid. This picture is very typical of a sperm granuloma, where sperms are trapped and causes swelling. At this point, the vets considered several possibilities as a differential diagnosis like epididymitis, inflammation of epididymis, sperm granuloma, blockage of ducts, orchitis, developmental problems, or sexual immaturity. But because both epididymal heads were swollen and the testes looked normal, sperm granuloma was the most likely diagnosis. Since the buck wasn't producing sperm and the swelling was severe, he was considered not fit for breeding. The recommended treatment was castration. During surgery, both epididymal heads were found to have large lumps full of yellow caseous material. When the tissue was examined under the microscope, it showed lots of sperm cells surrounded by macrophages and giant cells. And there was also a thick layer of fibrous tissue. This confirmed the diagnosis of sperm granuloma. Many reasons can cause sperm granuloma, such as duct blockage, injury, congenital problems, infection. In this case, the exact cause wasn't fully known, but both sides being swollen suggested a developmental or early obstruction problems. Tests for brucella and mycoplasma were negative. This case teaches us some important things. Firstly, always palpate the testes and epididymis carefully during breeding soundness exams. Second, a buck can look normal but still be infertile due to epididymal blockage. Sperm granuloma is uncommon but should be considered when sperm count is very low. There is no medical treatment for sperm granuloma. Culling or castration is the only option. In conclusion, this young buck was infertile because of bilateral sperm granulomas. His testicles were normal, but the epididymis was blocked. Diagnosis was made through physical exam, semen testing, ultrasound, and histopathology. The final treatment was castration since the buck had no breeding value.